My name is Elizabeth, and today I'll be presenting a research study titled The Relationship Between Self-Esteem of Nurses and Their Choice of Strategies to Cope with Workload Burden. So, this study is important because nursing is a profession known for high stress, heavy workloads, and the pressure of patient care. And understanding how nurses cope with these demands and how self esteem influences their coping choices can help us improve both nurse well being and patient care outcomes. So, the researchers had two main goals. First, they wanted to identify the coping strategies nurses use in a clinical practice to manage their workload stress. And then, second, they wanted to determine whether self esteem influences the preference for specific coping strategies. Specifically, whether nurses with high self esteem are more likely to choose adaptive strategies, and whether those with lower self esteem rely more on maladaptive strategies. So, before conducting the study, the researchers reviewed what was already known from previous studies. And it was well established that nursing is a very high stress profession with physical, mental, and even sometimes emotional demands. So, long term stress in nurses can lead to burnout, more errors, reduced quality of care, and even health problems for the nurses themselves. Stress not only affects nurses, but also has a direct impact on patient safety. So, prior studies showed that nurses use a range of adaptive strategies. These would include things such as planning, acceptance, and positive reframing, while maladaptive strategies like denial, disengagement, or even self-blame. So, importantly, self-esteem has been identified as a factor influencing coping. High self-esteem is linked to resilience and adaptive coping, while low self-esteem is associated with avoidance and maladaptive behaviors. So, this research was necessary to explore how self-esteem impacts nurses' coping in real clinical practice or settings, especially given increasing workloads and even staff shortages. So, what researchers did is they used a cross sectional design, and the study population included 509 nurses working in anesthesiology and even intensive care departments across Slovakia. So most of the participants were women. About 94% were women and only 6% were male. And the largest age group was between 40 and 44 years old. And many had between 10 to about 20 years of work experience as being a nurse. So, the recruitment for the study was done by sending a email invitation to members of the Slovakia Chamber of Nurses and Midwives. And nurses who agreed to participate completed an online survey. And this survey included two main instructions. So the first one was the brief COPE questionnaire. And this one measured roughly 14 types of coping strategies on a 4-point scale. So a 4-point scale would be with 1 being not at all, and then 4 being very much. And then the second one that was used was the Rosenberg Self-Esteem Scale, also known as the RSES, and it is widely used measure of self-esteem. So, and it was also on a 4-point scale, with 1 being strongly agreeing and then 4 being strongly disagreeing. Additional demographic questions were also asked. This would include age, gender, education, marital status, years of experience, and also their type of employment. So the data was collected between the months of July and December of 2017, and responses were analyzed using what is called a SPSS software. And the researchers calculated these statistics, such as means and frequencies, and then used what they call ANOVA test to explore differences in coping strategies across groups with either low, average, or even high self-esteem. So the researchers found that overall, nurses showed a strong preference for adaptive coping strategies rather than the maladaptive ones. And the most commonly used adaptive strategies were acceptance, planning, active coping, and receiving some kind of emotional support. And then on the other hand, the most frequently used maladaptive strategies were self-distraction, venting, and then the least ones that were used would include ones such as like substance abuse and disengaged behavior. So when it came to the self-esteem levels, 57% of nurses had high self-esteem. And then roughly about 32% had an average self-esteem, while 10% had low self-esteem. So nurses with the high self-esteem preferred adaptive strategies such as active coping, positive reframing, planning, and acceptance. And on the other hand, nurses with low self-esteem were more likely to use maladaptive strategies like denial, disengaged behavior, and even self-blame. So, from these findings, the researchers concluded that self-esteem does play a significant role in how nurses cope with workload stress. So, supporting and strengthening nurses' self-esteem may encourage them to choose adaptive strategies, which not only protects their mental and physical health, but also improve the quality of patient care. The study is conducted, the study is considered a plot study, meaning it lays the foundation for future research and potential like interventions that can help nurses develop both stronger self-esteem and healthier coping strategies. So this study did have some weaknesses. One would include the sample size. So still, while over 500 is a pretty good number, it's very small compared to the total number of nurses in Slovakia. And then the study relied on self-report questionnaires. So this would mean that the nurses would have to be honest and self-aware while answering these questions. Another thing was that the sample was 94% female. So the findings may not apply equally to the male nurses population. And then Finally, it was what they call a cross-section study, so it only provides information at one point in time. So we cannot say for certain that self-esteem causes differences in coping strategies, only that they are associated with one another. In my view of this research, it does have important implications for the nursing process, especially as a lot of us start our career. So we know nursing is demanding and stressful, but this study highlights that positive self-esteem can make a difference in how nurses manage stress, which is very important, especially just starting off in our careers and not really, and like going into it, not really knowing what to expect. It is very a good thing that we keep our positive self-esteem. So by using adaptive coping strategies, nurses can protect their own well-being and reduce the risk of burnout. And then ultimately, these benefits not only affect us nurses, but it also affects the patients. So if we go in with positive self-esteem and healthier coping mechanisms, it can directly influence the quality and safety of care provided to our patients. So this study shows us that self-esteem is more than just a personal trait. It's a professional resource. So by helping nurses build and maintain strong self-esteem, we can promote healthier coping strategies and increase the well-being of nurses and improve our patient outcomes. That was it. Thank you.